Hey guys, it's Maria. Uh, I am redoing this video for the millionth time, I guess. Um, I had a perfect video going earlier. It had my update, and I was showing you guys some things that I had purchased for my surgery, for my liquid diet, and for my meals after surgery. But the first part of the video where I am giving you my update got erased. So I'm redoing this part, and I will be adding the second part with all the items that I purchased in a separate upload. Please excuse my appearance. You guys already know that I haven't been feeling well for the past few weeks. And like I said, I was in bed and it's really late, so no makeup and in my pajamas. So please excuse me. Anyway, on to the update. I saw my anesthesiologist on Wednesday, the 26th, and everything went good until I had my blood pressure checked. It was slightly elevated. It has been slightly elevated for about a month or so. My PCP did not want to put me on medication because it wasn't that high, and she figured that since I was having surgery soon, I will be losing weight soon, and my blood pressure would go down soon. But the anesthesiologist said he will not clear me for Friday if I don't go back to my PCP and have her put me on blood pressure medication. He doesn't want to risk me going under and then have a problem with my blood pressure, and they would have to stabilize me or whatever. But anyway, that was taken care of. I had my blood pressure checked today and it was normal, so I guess I'm good to go for Friday. I saw my surgeon right after the anesthesiologist, and I tell you, my last video I explained to you guys how I was scared. I am no longer scared. Well, maybe just a little bit, but I'm mostly excited now. I can say, even though I haven't had surgery, that my surgeon has to be one of the best surgeons in New York. He was very thorough in his explanation. He had diagrams and models, and he answered every single ridiculous, because I had some ridiculous questions for him. He answered every single ridiculous question with a smile and in complete detail. As you guys know, I have an acid reflux problem, and he will be correcting that at the same time as my VSG. I don't know if I explained to you guys before, but he's taking the upper curve of the stomach and wrapping it around my esophagus to try to help contain the acid. He told me that the downside to that is that I will have a harder time progressing in the diet stages than other VSG patients because of the constriction, and that for the rest of my life I will be having problems burping. Now, I think I could live with that, especially being that right now my problem is severe cough, constantly losing my voice for weeks at a time, not being able to sleep because of the acid coming up and giving me heartburn. My stomach burns almost every day. I have productive burping. It's a nightmare, so I guess I'm going to have to trade all of that for some burp problems. I'm okay with it. He normally puts patients on a 10-day meal replacement diet, but he told me that he wasn't going to enforce that with me because I had been dieting already, and I had been working out and constantly losing weight. I was about 275 or 274 when I first started to see him, and I am now 245. So he wasn't going to enforce it on me, but he did explain to me how the diet works in case I wanted to do it anyway. It would be a shake for breakfast, a shake for lunch, a sensible dinner, and I was allowed to have 2 healthy snacks throughout the day. I did do the diet, and I did do okay with it until today. I don't know, I guess I wanted to say goodbye to food today. And I had my shake in the morning, but when I came home for lunch, I had a shake and a yogurt. Now, I mean, that's not too bad, but at dinner time, I had a decent meal, and I went back for a little bit more, and I had a piece of cake. It wasn't a huge piece of cake, but it was cake. Anyway, I'm not going to beat myself up for it because it was a small piece, and like I said, I have been dieting and trying to lose weight on my own for a while, so it's okay. I start my liquid diet tomorrow. I only have to do 2 days liquid diet, as I told you guys before. I'm sure it's going to be a little hard, but it's doable. So many people have done it, and I'm not going to be any different. Plus, I'm grateful that I don't have to do it. I'm grateful that I don't have to do it for a week or two. That it's only 2 days. So I'm good. Anyway, I think that was it. I'm sorry. I'm just trying to remember if I said everything, because like I said, I had a really good video earlier and I lost it. But I think that's all I wanted to say about my last appointments. And videos from now on, I don't know if I'm going to post a video before my surgery on Friday, but I will post when I come back from my surgery. I also don't know if I'm going to do videos from the hospital like some people do. I would like to, but I don't know how I am going to be after surgery, so I can't promise. But I do promise to come on here after my surgery when I'm feeling a little better, to let you guys know how it went, and you know, to give you guys that are having surgery after me a little insight. One more thing, my insurance company driving me nuts. They every time I call, they say they don't see anything in the system, that they are only reps, and reps usually don't see anything in the system until it has been approved or denied, and that I should give them a few more days. It is getting very close to Friday, and it's making me nervous. So I spoke to the insurance specialist at my surgeon's office. She said she would look into it, but that she's not too worried, even though we're getting close. She's not too worried because my insurance company has a tendency to give the approvals at the last minute, but that they rarely deny a patient. So I am going to try not to worry, and I'm going to let her handle it, and I'm going to hope that Friday I will be getting sleep. So I guess that's it for now. I'll be talking to you guys soon. Thanks for watching. Good night.